CBS News medical contributor Dr. David Agus is here with more on this. Now, David, you've seen the poll. Half of Americans say they're not confident about taking this vaccine. So should they? Should Americans be confident?
Well, the answer is I don't know yet. We have to see the data. And so it's very hard when you see these polls because there can be nobody advocating yet for a vaccine because we have to advocate with the data. Here is the data, how it works. Here is the safety data. And based on those, myself and I think many other doctors will stand up and say, you need to take this vaccine. It is critical to your safety and the country. But again, it really depends on the data.
David, one of the things we've heard from so many doctors right now is get your flu shot. We are entering flu season. Cases are on the rise when it comes to coronavirus. What other advice do you have for people as we are in this time?
So obviously the double whammy of COVID-19 and influenza or flu can happen. And so flu is preventable in large part by getting a flu shot. We all have to step up and play our part. So getting a flu shot is critical. And then obviously it's the mask. I mean, we had record numbers of cases happening now in many states. 70,000+ cases yesterday and 1,000 deaths. So numbers are going up, not going down as we enter the holidays.
And as we enter the holidays, Dr. Agus, Thanksgiving right around the corner here. Dr. Agus said this week he's not going to visit Dr. Fauci said he's not going to visit his kids this Thanksgiving. I know tens of millions of families around the country are thinking about this and talking about this. What should they do?
Luckily, my kids are here, so I don't have to worry about that. But it is a major issue as we get into increasing numbers. And if parents are elderly or grandparents are there, we have to have a lot of concern for them. So Thanksgiving this year is not going to be like other years, no question about it. At the same time, as we transition to indoors, as weather gets colder, we have to continue to socially distance and wear masks, especially when interacting with others, or there's going to be more and more trouble. I mean, the numbers are troubling at the present time. I can't say it in any other way.
Well, new research is out now from the World Health Organization, Dr. Agus, saying that the effectiveness of current COVID treatments is, where are we? Why don't I just ask you plain and simple?
So remdesivir, which was an antiviral originally developed for Ebola, now in a trial at the World Health Organization, 11,000 people got one of 4 different drugs. It did not change survival. The earlier study in the United States showed that it decreased hospitalization from 15 to 10 days. But this was a different study, and this is a study in sicker patients, multiple different countries. The patients and how they were treated were different. In addition, we have dexamethasone now, so a different treatment to help the lungs. And in that setting, remdesivir probably is an active drug, but it's not a great drug. We don't yet have a home run. My hope is the monoclonal antibodies will be maybe a lot better treatment in terms of treating the disease than remdesivir is at the present time.
Okay, Dr. Agus, thank you very much.